Theoretically, a breast augmentation will last at least 10 years, and there is no guarantee, but the 3 breast implant companies actually have a new warranty where the implants are covered for at least 10 years. I tell patients they might outlast you, they might be good for 20 or 30 years, or you might have a problem in a few years. So there's not a guarantee. I will see my patients in long-term follow-up every year to make sure that they're still looking good and feeling good, and I say if it ain't broke, we don't need to fix it. So you don't need to have another surgery every 10 years, only if you're having a problem or if you don't want them anymore. Statistically, because the inframammary fold incision is the most common, that tends to have the lowest rate of complications. Making an incision in the armpit or around the nipple and the areola where there are higher concentrations of bacteria theoretically can lead to an increased incidence of capsular contracture. And then the other main category is whether you put the implant on top of the muscle or underneath. There are studies that show increasing complications with either technique, and I think the most recent studies show actually a higher incidence when it's under the muscle. Breast augmentation benefits women who either have lost volume in their breasts, for instance after major weight loss or after pregnancy. With each subsequent pregnancy, regardless of whether you breastfeed or not, with the hormonal changes, the breast will become deflated. Also for women that feel that they're out of proportion. Their top doesn't match their bottom, and they really want to be proportional with the rest of their frame and their curves. And so breast augmentation is a wonderful way to help a woman feel more comfortable in her skin and feel more proportional. So there are a number of different incisions you can make for breast augmentation. And the most common one that's used is in the inframammary fold, the fold under the breast. It's about 1 inch long, and that's the incision that I prefer because it preserves the 2 functions of the breast, which are ability to breastfeed and erogenous sensation to the nipple. So for most patients, I would recommend that incision because we do want to preserve breast function. If she ever needs another surgery in the future, then usually we need to make that incision. So that's the one that I prefer over all the other ones.